Welcome everybody, Lori, Women's Health on the Go, where I provide telemedicine for women. And what is telemedicine? Telemedicine is seeing a medical provider via video stream. I know right now you can see me, but during a visit I actually see you through like FaceTime or Skype, and we can address lots of women's health issues such as birth control, morning after, treating simple vaginal infections, or sometimes people just have a problem. They've spoken to previous providers, but they have a lot of questions and they just want somebody to sit there and talk to them, and that's what I do. So if you have the need for me, make sure that you go over to my website, check out my website, and also book an appointment with me, womenshealthonthego.com. Today we are going to talk about uterine fibroids. This is a condition that is very, very common with women. And I talk about it a lot with women, so I thought it would be a great idea to talk about it. Just a reminder to every woman out there, it is Cervical Cancer Awareness Month. So make sure, if you haven't gotten your pap smear, make sure that you go see when you're due. Make sure that you check in with your healthcare provider. That's really, really important. 12,000 women are diagnosed with cervical cancer every year still. About 4,000 of them will die. It still is a problem. So make sure that you go get your pap smear if you are due. Okay, so let's talk about uterine fibroids. Uterine fibroids are very, very common. They are benign growths that we can develop basically either within the uterus or within the wall of the uterus or just outside of the uterus. Again, they're very benign. Typically, we really don't do anything with fibroids unless they are bothering you. Sometimes women have very, very heavy periods with them, or sometimes because they grow to a certain extent, they start pressing on other organs and causing pelvic discomfort. But typically we really don't do much with them. They can vary in size, and we're going to go a little bit more into size in a minute. But about 20 to 40% of women are going to develop fibroids by the time they are 40 years old. Okay, these they live off of predominantly estrogen, but they can also live off of estrogen. And women that are at a higher risk are basically women who have a longer exposure to estrogen. If you got your period when you were very, very young, and then you went through menopause very late, if throughout your life cycle you didn't have any children, or you had just one child, you're at a higher risk. If you, nowadays, which it's really hard to kind of avoid these things, but those estrogens, such as in plastics, such as in, they talk about hormones being in our dairy and in our meat, and pesticides and stuff like that. That's another way of being exposed to the estrogen. And those who actually also, women who are what I call got a little extra cushioning, they're a little bit on the heavy side. Estrogen typically gets stored in the fat cells. So if you're overweight, you're more likely have more circulating estrogen in your body. So you are at a higher risk as well. And then there's the talc that people use down there. I know that there's been this controversy of whether talc causes certain cancers down there, and there was just actually a case that actually finally won against the company for talc. So I'm sure that there's going to be more of that coming out, but talc is also known to cause fibroids to grow, which are very benign growths. Again, they're not cancerous growths by any mean, but they can, that stuff can cause you to actually get fibroids. So there's different kinds of fibroids, meaning more like where they're located. If you think of your uterus, There's different kinds. There's one pedunculated kind, and the easiest way that I kind of describe that is like a beehive. You have a branch on a tree, and then there's this big beehive kind of hanging here. That's like what a pedunculated fibroid is like. There's a little stalk that's inside to the base of the wall of the uterus, and then you have that little kind of fibroid. Those are if you need to get them removed, that's a very easy one to get removed. And then there's ones that are actually on the outside of your, it's attached to your uterus. It's still within the uterus, but it's on the outer portion of it. And then there's ones that are within the wall muscle of the uterus. And then there's ones that are more like in the lining on the inner part. The ones that are typically like in the muscle wall and then the closer down the inside, they tend to cause a lot more bleeding during your period. Another thing that I have found is that, and just in my years of experience of people coming to me with fibroids, size doesn't really matter with your symptoms when it comes to bleeding. I personally find, just I guess if I did my own little survey of all the women that I've diagnosed with fibroids, and those that have really heavy periods are the ones who tend to have smaller fibroids. It's the ones who have huge fibroids, and I have felt fibroids that have been large as someone from anywhere to 4 to 5 months of pregnancy. So if you think about your uterus grows, your uterus is about the size of your fist, and about 5 months, around 20 weeks, the top of your belly, where your belly button is, that's where the top of your uterus is. So I have felt fibroids that have been actually that big, because they can get pretty big. But those people, sometimes they don't even, besides they're like, oh, is that why I thought I was just getting fat? No, that's not why. You actually have fibroids that are in there. They don't tend to sometimes have kind of symptoms. They can press on other organs, and sometimes people can have urinary frequency, problems with their bowels, pressing down there, pain during sexual relations as well. Those kind of symptoms can kind of happen, but sometimes they just think, oh, I'm just getting older. This is a normal part of life, but it really ends up being that they actually have fibroids. Where I tend to find that the smaller the fibroids are, the heavier the period is. Now, it doesn't mean what I'm saying. What I'm saying doesn't mean that if you have a large fibroid, you're not going to have heavy periods. I mean, does that happen? Yes, it does. But if I were to say more commonly, the little fibroids tend to have a little bit more bleeding than the larger ones. The big question always is, can I get pregnant? Will this cause me problems getting pregnant? And that really depends. Depends on where they're located, how large they are. Sometimes women do have problems getting pregnant when they have fibroids. If they have one fibroid, maybe not, but if you have multiple fibroids and they're on the lining of the uterus, where's the little sperm and the egg that come together? Where are they going to implant? It's going to have a very hard time doing that. So yes, women can have problems getting pregnant, but then also women can get pregnant and they can deliver and have a wonderful pregnancy. Fibroids, again, it's another thing. I can't tell you what's going to happen. Either your fibroid may shrink a little bit, it may stay the same size, or it may grow. And the problem is, if it grows, baby's almost kind of competing for that space to grow. So when that kind of happens, you're closely monitored during pregnancy. They're going to always check to make sure the baby's growing appropriately. And sometimes they may have to deliver you a little early just, because there's no room for the baby to grow. So, but you can absolutely get pregnant. With fibroids, you would just be considered a little bit more of a high-risk pregnancy, just because of the fact that depending on the number and the location and what's going on with the fibroids and how they're reacting with the baby. A lot of women that end up having fibroids end up having anemia, especially those who have very heavy periods, and they tend to be very tired. So that's a kind of a symptom. Like I said before, sometimes women don't have any symptoms at all. They don't even know that they have them, and they just happen to find out during a GYN exam. And sometimes, when we do an exam and we're pressing down on the belly, typically your uterus is how do I describe feeling a uterus? It's solid, but it's also not really firm. When you have a fibroid, your uterus tends to be a little bit more solid and more firm when you're palpating it. And of course, again, as I said to you, uterus is about the size of your fist. And when we do a pelvic exam, we're trying to feel the size of it and to see if it's increased in size. So sometimes if you have a very small one, you can palpate that if it's more of a solid kind of feeling, and then you're also having really heavy periods. That's a really good indicator that you may have fibroids. Hi Debbie. Hi Debbie, I see that you're here. Welcome. I hope all is well with you. Thank you for joining me. We're talking about fibroids. Hopefully this is an interesting topic for you tonight. Lots of women have it, so hopefully you'll find this information informative. So back to symptoms of fibroids. So again, there could be absolutely nothing. A lot of women will come in if they have really, all of a sudden they'll have a change in their period. The flow of the period can vary. I mean, it's depending on what your baseline was prior to that as well. But some women will bleed so much that they are changing. They're using a tampon and a pad, and they're changing every hour, and they're bleeding for like 7 to 10 days. That is an extreme case of fibroids. To just, I used to be 3 days, light bleeding, and now I'm really heavy for 5 days. So, and if anybody comes to me with heavy periods, one of the things is that I do want to rule out fibroids, and the way to diagnose that is to get an ultrasound scan. Some other symptoms, pelvic pain. As I said to you, some of those women who have larger fibroids, they can be pressing on certain other organs. So sometimes people have a little constipation, a little bit of hard time passing their bowels. They'll have pressure on their bladder. Maybe they're going to the bathroom all the time. Maybe they're also having, now all of a sudden they're having pain with sex, because now the fibroid's kind of growing, and then when you're having sex and it's pushing on other organs, and then women end up having pain with sex, and that's not good. We need to always fix that if we can. So, and again, like I said, that with these women who have the heavy bleeding, you can end up having anemia. So what do we do with fibroids? If they're not bothering you, I say that they're your new friends and enjoy them, and we don't do anything with them. And occasionally some providers, depending on if your symptoms change or in a couple years, may do an ultrasound. Initially, if I diagnose with someone with fibroids, I will typically get another ultrasound at their next year. There is a very, very rare instance where those fibroids are typically benign, is not really a fibroid, and it's a cancerous growth. So typically what will happen is that usually fibroids don't grow, we'll just say a lemon size to like a grapefruit size within 12 months. If the change of the size occurs, it's going to be like, well, it's 1.2 centimeters this year, and it's 1.3 centimeters if they even grow. Most of the time they'll just stay the size that they are. But typically I'll get an ultrasound the next time I see them, and just check for that growth, and then depending, get it a couple years later or something, just to keep an eye on, of course, if their symptoms change. So doing nothing. Sometimes people now, some people get what we call injections of Lupron, which basically kind of just induces menopause. And I don't find that it's very common that doctors prescribe this. I think it's definitely still out there, but it's not as common because you're suppressing estrogen and progesterone. Now you have a whole bunch of other, now you had, your fibroids, but now you're having hot flashes, you're having vaginal dryness, you're having pain with sex, you're now having, because you're having that lack of estrogen, now you're having more vaginal infections, you're having headaches, you're going through menopause. I mean, that's not the most comfortable thing to be going through. Some women go through it with a, free, clear, and a breeze, and nothing ever happens. But then for others, not so much. So, but when you do the Lupron, it does decrease the size of the fibroids by 30 to like 64%. Now, sometimes, now there's different kinds of surgeries that you can have that will take care of fibroids. Now, sometimes if the fibroids are so big and you're going to end up having the surgery, sometimes they will give you the Lupron prior to the surgery to kind of shrink them up a little bit so that the surgery is not as bad. And again, this really depends on the type of fibroids you have. Now remember, I had earlier mentioned there's pedunculated ones, which is like a little beehive. Those are really easy to get rid of. It's just almost like taking them out. Where the ones that are within the lining of the uterus, in the muscle wall, and on the outside are a little bit more difficult, and it just depends how they're going to do it. And this is where you definitely have to go to your medical provider to go over all the different options. And I firmly believe that if you do go and they want to do surgery on you, it is not a bad idea to get a second opinion, because there are many different surgical options out there. I know that they're coming out with newer ones every day, so definitely go and get a second opinion, or even just Google is a great thing. Go out and Google and say, okay, uterine fibroids treatments, who in my area, and come up with the different, go to someone to get other different options. So you can just remove what we call a myomectomy, which is actually just removing the fibroid. Again, this is kind of a situation where, depending on the size, they may use a Lupron before to kind of shrink it a little bit to make it a little bit easier. The problem with when you have them removed, there is a 15 to 30% chance that they're just going to come back within the next 5 years. So that can happen. But I'm going to, towards the end, talk about things that we can naturally do to kind of help fibroids. But if then you had the myomectomy, there's some things, if you kind of follow those things as well, then you can, definitely, hopefully help prevent them from occurring as well. There's always hysterectomy. Hysterectomy typically is in women who are beyond their childbearing ages. They're not really concerned about getting pregnant anymore, and sometimes women are just like, get this thing out of me. I don't want it anymore. So hysterectomy is definitely. There is uterine artery embolization, which basically cuts off the blood supply. The fibroids are growing, they have a blood supply, and basically what they do is they go in and they cut the blood supply off to the fibroid, and therefore the fibroid kind of shrinks and dies and goes away because it no longer has a blood supply. That's another option. Another one is ablation. Ablation is kind of used for lots of different things. Basically what ablation is it's heat, and they're heating the inside of the uterus, and to a certain degree, I'm not quite, I think it's like 150, but don't quote me on that one because I'm not really quite sure of the actual degree. But it basically burns them and kind of kills it because they burn it. And there's different kinds of ablation kind of procedures that they can do. That one is really not one if you're really thinking about that you still want to have children, because it's basically frying the lining of your uterus, and you probably won't have a period after that for a very, 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 very long time. So again, that's not something that necessarily you would do if you were concerned of having children one day. Now the thing too is, when you have these, now that one definitely not with pregnancy, but then when you have like a uterine, when you're cutting off that blood supply, there is the risk of scarring the lining of the uterus, which then can also cause problems with getting pregnant. So if you have fibroids and you are really thinking about, having some kind of surgery to take care of it, and that you do still possibly want to have children, that is something that you really have to make sure that you talk to your provider with, and make sure, because you want to make sure that you pick the perfect option that is for you. And then a common one that, you know, even I can do in an office is a lot of times, sometimes when it comes to fibroids, we're really just they're benign growth, so we really don't need to do necessarily anything with them unless we're having symptoms again. So the big fibroids sometimes people tend to get surgery. But if you're having very heavy bleeding, then all we got to do is just control that bleeding. And there's lots of ways that we can do that. Birth control pills. That's another thing. Birth control pills. Getting the depot injection, which is a progesterone only injection. That's another way that you will not get your period, and it helps with the bleeding. What we call a Mirena IUD, which is a progesterone only IUD. That's another thing that is done to help with fibroid bleeding as well. So those are kind of in office, I'm having really heavy bleeding and I want to do this. Now there is, I read that the research shows that it does this, and then I read that the research shows that it doesn't kind of do this. Now, fibroids live off of estrogen and some progesterone as well. So when you start taking birth control, which is hormones, what do they do to them? Does it increase in size? Does it not do anything to them? What exactly does it do? I have read some research where there is a possibility that it can increase in size, and then I've read that it really doesn't do anything. I tell my patients that there is that possibility because I've read research on both. I say, listen, I'm going to tell you this kind of research over here because if it doesn't bother it, then who cares? But I want you to know that there's a possibility that it can change it. It can increase the size of this fibroid. So again, debatable research of whether it does that or not. But I tell my patients that it possibly can, because I'd rather them know than not know. And I always encourage everybody to do your own research. This is your body. When you go to a provider, it's not his body, it's not his life or her life or her body, whatever your gender your provider is. It's always important to go home and do your own research. Be your own provider. Just because one provider says something, it doesn't mean that it's, written in stone. There are wonderful providers out there, and there are also not so wonderful providers out there. So I always encourage, when I see patients, I'm always like, listen, this is what I know. This is the research. If I don't know what's going on, I'll research it for you. But I always recommend go home, read the literature, find out your own information, do what you feel is comfortable. Also, if you want to get a second opinion, go for it. Absolutely. The better and the more knowledgeable you are about your life and your body, it's going to be just better off. The only person you have to live with for the rest of your life is yourself and no one else. So you want to make sure that you take care of yourself 500% and make sure that you have a nice and healthy long life. So, not to get off on a rant on the other side, but because we're getting, oh my gosh, I can't believe how fast these shows go. It's already 23 minutes into the show and I can't believe it. Okay, so I haven't gotten into natural kind of stuff. Okay, one natural thing, which as much as I'm very into research, I want to see the statistics. I want to see, does it work? Does it not work? I can't seem to find any research on this, but there are so many people that say that it works. So I'm going to tell you about it. And it's a little bit of a tongue twister for me, unfortunately. Hot castor oil packs. I can't say that all fast because hot castor oil packs. There you go. I said it really fast. So castor oil, there is a process to do that. I know that there is somebody on, there's a couple of people on YouTube that go through the whole process of doing it. But hot castor oil packs are great for fibroids. People use them for fibroids, ovarian cysts, tumors in their breast, and it basically you've got to there's a whole process that you got to do it, because castor oil is really disgusting and sticky. You have to put plastic down. You have to get a non-bleached towel, like a wash rag. You soak it in the castor oil. Then you put a plastic, like a little plastic. You put the no, I'm sorry. You put the thing down first. Then you put some plastic. Then you have to put some kind of hot heat over it, like a heating pad, or like I have that little bag that you put in the microwave and it's got the rice in it and stuff like that, and you put that on top of there. And you can't do it during your period. You can't do it, like, you have to do it only certain times, like 3 weeks on, 2 weeks off, and you do it every day, and it's supposed to draw the toxins, shrink the fibroids, shrink ovarian cysts. There's lots of information online, and again, there's no research on it, which, I'm a research freak, but everybody says that it works. Everybody that talks about it out there. So I always talk to people about that. Acupuncture is amazing. I love acupuncture for a lot of women's health issues. A lot of women's health issues, when you go into Chinese medicine, it talks a lot about blood stagnation, and I've also read about liver qi, and having to increase your pelvic circulation. And you can do that lots of different ways, but one of them is definitely, if you know acupuncture. Acupuncture is the flow of the qi along the meridians in your body. They put these little kind of needles in you to help open up that flow. And I have sent many people for their periods, fibroids, and it really is amazing the kind of results that that you get. Another thing to do is and following an anti-inflammatory diet. Now, anti-inflammatory diet is something too that I think that if you were to have them removed, if you continue to follow an anti-inflammatory diet, I would think that would help prevent you from getting them in the future. A lot of things that are in our lives, our medical problems, have to do with inflammation within our body, and following an anti-inflammatory diet will help with that. I'm going to have to do a whole conversation about cortisol levels and all the hormones and all that kind of stuff, and about inflammation and stress on our body as well that can cause inflammation. But following an anti-inflammatory diet is something that's really, really great. It's also great for if you have painful periods as well. And that is avoiding dairy, red meat. Now, people who have fibroids kind of sometimes need red meat, because if they're anemic, they need the heme that's in the meat. So I usually tell those people, maybe like earlier in the cycle, have your meat, but when you're having your period, try to, decrease that inflammation to that pelvic region. And follow that. Eat lots of fruits and vegetables, cold water fish. If you don't like fish, adding a fish oil supplement to your diet as well will be really, really good. And there's lots of information online about anti-inflammatory diets as well. And then another thing, if you want to also be taking care of yourself and eating really healthy. Hi Ross, how are you? Welcome. Talking about uterine fibroids. It's a very hot topic. I hope you enjoy your time here. Okay, so herbal infusions is another thing. I do herbal infusions. This month I'm actually going to do a video on doing herbal infusions. And basically there are certain herbs that you can take. I have like I think it's a pint, and you get a larger amount of herb, and you pour boiling water over it. You let it steep overnight so that the water and the hot water is just extracting all of the nutrients from the herb, and you drink one every day. A really, really good one, especially for anti-inflammatory, is stinging nettle. Stinging nettle is really, it's got a lot of vitamins and nutrients and stuff. And I always try to recommend herbal infusions. There's lots of different ones. There's red clover, there's oat straw, there's stinging nettle, there's red clover, that I try to do a different one every day. But the stinging nettle is really good, especially when we're talking about anti-inflammatory and getting really good nutrients into our body. Definitely doing that. You want to get the blood flowing. Remember, I was just talking about the Chinese medicine and about the pelvic congestion. You want to get the pelvic circulation going, and therefore you want to make sure you do warming kind of. You want to stimulate the flow. You want to stimulate the blood flow to that area. So you want get the blood flowing, get the circulation, exercising, walking. You know, they also talk about yoga and belly dancing, getting that area moving, and then warming foods. As compared to eating cold foods, and like ginger and cinnamon are really good as well. And then a herb, when we talk about herbs, again, if you were ever to do herbs, make sure that you speak to someone that is knowledgeable about it. Herbs are, they should be respected just like pharmaceutical drugs. Herbs are plants, they have chemical components, they work in our bodies just like drugs. So I always say, whatever any information that I'm putting here, always make sure you do your own research, talk to your own provider, but make sure, because herbs, they interact with other medications and medical conditions, so just make sure that you definitely talk to someone prior to doing that. But when it comes to uterine fibroids and herbs, it's almost like it really depends on what's going on with the patient. Vitex, or better known as chasteberry, is one that we use a lot for, just because it's a kind of hormone regulator. So we want to kind of regulate all the hormones in our body, because if you have excess estrogen, we want to kind of decrease that and regulate and make sure the hormones are kind of smooth going. Another thing that we like to do as well is do liver cleansing herbs, because especially when we talk about, I talked about earlier about women who are a little extra weight, estrogen tends to store in the fat tissue, and we want to make sure that your body is excreting all that excess estrogen out of your body. So sometimes what we do is we add a liver cleansing herb like dandelion to it, to make sure that we're cleansing out all that stuff out of your, not only excess estrogen, but also, when we, all the toxins that we do to our liver, let's just put it that way. So we do that. And if you have anemia, then we're going to be looking for herbs that are going to help with anemia as well. So it really kind of depends on what is going on with you and what are your symptoms of what we're actually going to use. So that is fibroids in 31 minutes. I know that there's probably a lot more information I could share with you. I always just want to make sure I can try to give you as much information in 30 minutes, just so you have the basic knowledge of what I'm talking about. So if you have any questions, please do not hesitate to either reach out, or if you want to have an in-depth conversation with me about it and get a second opinion from your diagnosis, absolutely make an appointment with me. Just, make sure you go to womenshealthonthego.com. It has everything about me, and there's also, to book your appointment. So definitely make an appointment with me. If you haven't signed up for my newsletter, I just sent out the January newsletter today. If you sign up this week, I'll definitely make sure that you get the January newsletter. I usually have lots of little different kind of stuff in there. This month I actually had a video as well. So make sure you go over to the website, and it's just womenshealthonthego.com/subscribe, and you can sign up for my newsletter. I am also working on having a guest in a couple of weeks. I'm very, very excited about this. So I'm going to try to have some guests about other natural alternative ways to kind of take care of ourselves as women, so that we have the option of not just conventional medicine, but also alternative ways to care for us. So I'm really, really excited about that. I'm working with that person to get them. We're gonna, I think we may go on the road and do the video, but we'll see how that works out. Thank you very much, everybody, for joining me this evening. If you're watching the post show and you have any questions, again, either reach out to me down below or book an appointment with me. And I hope everyone has a wonderful, wonderful week. And remember, everyone, women's health matters. Our bodies matter. Make sure that we take care of ourselves. And I will see you next Monday at 8 p.m. Thank you and have a great week. Take care. Bye.